I have another tour planned for you today. Today we're at the lower level of the medical center, clinic lower level. Down here we have a lot of different specialties, but what we want to talk to you about today is wound care, and more specifically our hyperbaric chambers. So follow me in. We'll go down and find the staff here and see what this is all about. You see we have a newly remodeled area here. Just opened earlier this year in 2008.
How did you register? Did you register under
Here we come
clinic?
to the staff.
Yeah, okay. And you won't be able to get labeled.
Part of the staff for wound care here. We want to start by introducing you to Dr. Denise Burris. She's our wound care medical director, and ask Dr. Burris a couple of questions about wound care, and then we'll head on in to our new hyperbaric chambers. Dr. Burris, can you tell us what the specialty of wound care involves?
We see wounds that don't heal and have been other places and come to us for specialty care.
Okay. And is that something unique to us at Elderly Medical Center?
Yes, the hyperbaric chamber is.
Okay.
The wound care, some places practice wound care but don't have the ability to do hyperbarics also, which brings it full circle, and we can treat a lot more wounds that way.
Okay, that's great. I know we're seeing a lot of patients. This is Kim Kirschbaum, who is our, what do you call yourself, Kim?
I am the program director of the wound clinic and the hyperbaric medicine unit.
I know we're seeing a lot of patients. Tell us about how that's going, or how we've had such an increase since you've opened.
Actually, we have increased probably by about 65% our business, and a lot of it has been just because of the addition of hyperbaric oxygen therapy, but also because of our outcomes. We are at 97% with our healing percentage right now.
That's great.
Within a 14-week time period.
Now tell me, I've heard the rumor that we're one of only, 3 hyperbaric sites in Minnesota, is that right?
We definitely are. We're the third in the state of Minnesota, one in Minneapolis, the Twin Cities area, and the other in Rochester.
That makes us pretty unique then, doesn't it?
Definitely.
Did you want to introduce your staff?
Absolutely.
They're here.
This is Jody Hacker. Jody is our safety director for the hyperbaric chamber, and then we also have Darla Davies. Darla is a hyperbaric technician.
Great. Should we head on in?
Thank you.
We'll let Dr. Burris lead the way here. Oh, wow. I have to say I've never been in here before, so it's new to me, too. Here we have the hyperbaric chambers. To me, they look kind of like space shuttles, or what I see on science fiction movies where they get into the rocket and sleep for a while and then come back 20 years later. But that's not what we have here at all, is it? Although it's futuristic, I imagine. So tell me how these work. How does this function?
What we actually do is, right now, is for breathing room air. This is at 1 ATA. What we are going to do is we are going to simulate an actual dive, like you're going undersea, bringing that patient to a level of 2 ATA, or equivalent to 33 feet below sea level. We even go more aggressive for other types of diagnosis, where we go to 2.4 ATA, 45 feet below sea level.
So oxygen levels, they have to do with internal or external, or how does that work with wound care?
The chamber has 100% oxygen coming into the chamber, so you're surrounded with 100% oxygen. You're breathing that. So it's bringing increased oxygen to your tissues.
All right. So it's not necessarily an external thing. It's really,
Well,
you're bringing all the
internal.
oxygen into your body and on the outside of your body, too. Okay. So how does a person go about getting equipped to get into one of these things?
Actually, what we will do is, sometimes they do need help getting onto the gurney, but I can demonstrate for you if you'd like.
Great.
Okay, I can have one of the gals put me into the chamber.
Okay.
And I would get up on the gurney. Of course, something very, very important that we always instruct our patients on is to make sure that they don't have any makeup on, any alcohol-based products, because we're getting into a 100% oxygen environment. So we can't have shoes, no street clothes. We give them 100% cotton gown, and that's all they can go in with.
That's it, huh?
That's it.
Anything else disrupts the...
It's actually just more of a safety issue
Okay.
because of the alcohol base. You can't have a recent permanent, no hairspray because of the off-gassing, and that'll mix with 100% oxygen, and it could be a risk.
All right. That's why we have a safety officer, I assume, huh?
And my safety officer will ask me a series of questions before I go in every single day.
Okay.
These are repetitious. We're going to go in for 2 hours at a time every single day for, on average, 28 to 30 treatments. And maybe she can ask me a few of those questions.
Jody, what are some of the questions you ask patients before they go in?
We ask them if they're wearing any lotions, any deodorant, hairsprays, if they have dentures, we have to make sure they're out. Any medication patches, again, any dental work, any hair dye, anything like that. So we go through, it's a whole list of.
Is it kind of like when people have a CAT scan and they can't wear jewelry or any of those kinds of things, but even more restrictions, I assume?
Right.
Okay.
Right. Cardiac status has to be stable, a recent pacemaker, we have to make sure that we're looking at the manufacturer of the pacemaker. Something else is we actually put a grounding strap on the patient to make sure that they're grounded right to this unit, because static electricity could pose to be a problem as well.
So they're in for 2 hours?
Yes.
And how often might they come, Dr. Burris?
Every day, 5 days a week.
Okay. For 2 hours. So what do you do while you're in there
Well,
as a patient?
what they do is they actually make sure that we're communicating with the patient for the first 15 minutes until they reach their prescribed pressure level, because you have to be able to communicate if you're having any issues with your ears or barrel trauma. It's kind of like being on an airplane. If there's any crackling or they can't clear them, our technician has to walk them through that. Once we get down to the pressure, they'll turn this television on. That's right on top of the chamber.
You see we have a nice state-of-the-art television here. What's that, HD TV or
Yeah.
high def or whatever?
It certainly is, and we can also watch movies, either a VCR, or we do have a library of movies here
You
for the
do?
patient. Yes.
Oh, that's great.
This is their special spa time. We
That
turned
would
on the
be
lights.
nice for you to just come to relax
Yeah.
for a while. Well,
Absolutely.
that's cool. So does anybody ever get claustrophobic in there, or?
To tell you the truth, no. We have a few who ask those questions, but if you can look at the chamber, you can see that it's all clear acrylic on both sides, and so that has helped us immensely with taking that fear away.
All right. So before you start this treatment, Dr. Burris, you've looked at the wound and you've measured the wound, but then you do a comparison, or how does that work? After you've had treatments, you look at it again and you see a difference?
Certain wounds have to have criteria to continue therapy. After a certain period of time that they're in the chamber, say 20 treatments, for instance, a diabetic would have to have 30% decrease in the surface area of the wound.
Okay. Are diabetics your largest patient base, do you think? Most of them, they're diabetic
Most
type
of them,
wounds?
but
Yeah.
we do see other things too.
Okay.
Cancers with radiation therapy, surgical wounds,
Any kind of crush injuries, osteomyelitis, or a bone infection that just doesn't heal.
Okay. So you come for 2 hours, you come every day for, depending on your kind of wound, how long, many weeks that would be? Okay. And do most people just call up and say, I have a wound that doesn't heal, or are they referred by their family physician or some other kind of specialist?
most are referred.
Okay.
But some people have called and have seen advertisements, and we'll get them in, evaluate, and see if it's appropriate to use the hyperbaric chamber.
Okay. Well, that's great. So now you would go into the cylinder.
You want to go ahead and do that, Jody?
Well, we can do that. We can do that.
All right.
And demonstrate that first this is a grounding strap that we're talking about, so we always put that on the patient
Okay.
first. So she would wear that. There's a little safety latch here, we gotta unlatch. And push it in until it latches in, just like that.
Oh, and then we move the gurney. And we shut the door. There you go. Just like that, and then she's in there for 2 hours, right?
And from there, we'll turn it on.